So our target is actually like 100,000 lives for this vulnerable population. So let's say we are 40% gone.
Okay.
There's so much to do. We hope to hit our target before this year runs out. And I'm sure by the time I come next time here, I'll let you know how far we have gone with that.
Okay. Now, with your definition of what health insurance is and what this particular program is doing, please help me understand. Are these people still paying ahead of time for their health?
All right. So these people, government is paying ahead of time for them.
Okay.
So for us to, let me give us a background. What we're trying to achieve as a country, as a whole world, with the SDG 3, which is good health for all, and the target 8 of universal health coverage, is to find that people, when they need health care, they can access it without having to go through financial hardship. We know so many people that have to sell their keke or sell, like a motorbike, sell a piece of land because someone needs to have a surgery or someone needs to deliver and all of that. So we don't want people to have those kinds of financial hardship. And in any case, you don't know. It's like a pregnant woman. You may not know how you will deliver. Everything may just be okay, and then you have an obstruction in labor. And all of a sudden, you require an assisted delivery. If there was no plan, then you would have to borrow, you would have to steal, people do all manner of things to ensure that they can get their relatives out of such a situation. And so what government is doing, if you recall, there have been HMOs, there have been health insurance long before now. What the state is running is a social health insurance scheme. And so when our governor came on board, he realized that there are a lot of poor people. The economy is not getting better. There is inflation. These people are looking for how to get meals on their table, how to move from one place to the other.
Yeah.
Let me take on the burden of these vulnerable populations paying for their health. And so that's the birth of this agency. Okay, it's a way to help those who are poor and vulnerable have equitable health care, just like other people who can afford, who don't have to even do anything. They just wait. Maybe the millions are there. They need something. They pay for it, and it's fine. But that is not in itself also a good idea, because sometimes money can't help you. Maybe the money is in the bank. Maybe you try to do a transfer, it's not going. And then the hospital says, oh, you have to make this deposit. Then what happens? So even then, you may have the money, but at the point of care, you may not be able to bring out that money. And so worldwide, health insurance has been known to be a more sustainable way of financing health and ensuring that there is equity, ensuring that there is quality, and ensuring that no one is left behind. And so we're excited in Rivers State because now we can join the Committee of States, of Nations, to say we have a health scheme that people who are poor and vulnerable, who on their own may not be able to access this health care, can actually access. So back to your question, government, someone is paying. Someone always pays for health.
So even though it's free of charge for the people,
person,
the person,
someone is
paying.
Absolutely.
Okay, so you're saying it's for the vulnerable. These vulnerable people, are they like Rivers State indigents alone, or is it Rivers residents? Help us understand.
If you live in Rivers State, if you work in Rivers State, this is just one of our plans that we have started. Before the year closes out, we're going to have another plan that hopefully I'll talk about, and that's a plan that the governor has highly subsidized. And we call it the Simjara plan because, if I tell you the amount, it's just ridiculous that you can access healthcare for a whole year with that amount of money. So whether you live and work in Rivers State, whether you're from Rivers State or not, you have access to the health plans that we have in our program. So it's not an indigent thing. It's if you live and work in Rivers State, because we are interested in the health of the people that and work in Rivers State.
Right. Could you talk to us about the plan, right, that the current administration has to ensure that there are no setbacks with ensuring that people are not left halfway? Like, okay, so we start this in this year, 2024. Yeah, we're rolling 2025. Before we know it, it's losing momentum. People are like complaining, it's not working. So what are the plans to ensure, or perhaps I should be asking, how long, what's the plan for how long this is going to last, really?
All right. So RIFCHIP, which is the River State Contributory Health Protection Program, has come to stay. It is backed by a law. It's not just a whimsical thing. Backed by a law that takes its roots also from a National Health Act. Okay. So whether it's this administration or the next is something that would continue. Okay, there's already a governance structure for that, and it will continue. Now, another thing that will sustain this is the fact that there are different plans. So the way health insurance works, if you have more money, you pay more money. That's how it works. That's what equity is about. So both of us need to look over a field, but you're shorter than me. You need a higher stool than I do, so that we can both have a view of the field over the fence. And that's what health insurance also does, you know, in the social health insurance space that we are practicing. So we have a plan for formal sector. So those that work with government, they're going to have to pay because they can.
Okay.
They're going to pay a little every month, and government is still going to support that so that they can access healthcare. Informal sector, we've said there's a plan for 50,000, which you and I know that by the time you treat 1-2 bouts of malaria in a month, it's gone. But that plan can give you access to even surgeries, deliveries, whatever it is. Because if at the level of the primary care, the challenge you have, the illness you have needs a secondary care, you'll be referred for that, and it's paid by the system. So sustainability, it's one, on the fact that there's a governance structure, there's a legal framework, and then two, sustaining the finances, ensuring that the medications and everything is available. It's having the subsidy from government with people making their contributions. Because I tell you, we ran the free medical care program, and I was privileged to work in that program for several years. That program was from the year 2000, and of course became kind of moribund in 2014, 2015. People abuse things that are free.
Yeah.
So when you are making a little commitment and you're paying that thing, you know that you will use that facility. So for us, this is it's changing the health landscape. You find that more people can access our healthcare facilities. They can get the right care that they need instead of just self-medicating. For instance, you remember that I'm on a health insurance package, so you would go to the facility. That way it will help us to reduce the number of what we call polypharmacy, people just taking medications anyhow they like and in large numbers. Sometimes they don't know that 2-3 things that they are taking is the same thing, but because they have different brand names, and causing a lot of complications, the like that we see nowadays. So the health insurance is here to strengthen the entire system. It's also going to strengthen our primary healthcare system, because now people can go to the primary health center and they can actually demand for services and better treatment and quality. And we're there at the back end to monitor what is going on. Currently, we have like a town hall for pregnant women that we run. And as they go to the facility, they're able to tell you, Doc, they said I should pay 500 naira for this. Am I supposed to pay? And you say, no, you're not supposed to pay. Don't pay. You know, that kind of thing. We've had people even refund.
Okay, because I was going to come to that.
Oh, absolutely.
All
At
right.
least in the last 1 month, we've had 2 facilities have to refund a client for something that they had to pay out of pocket. The idea is that these people, they are government people. They are covered. So you treat them based on the plan that they are under and ensure that they don't have to pay anything out of pocket.
Well, that's interesting. Now, for the insurance scheme, now, where are these people getting the care from? Right? Is it for government-owned hospitals, or can someone walk into any hospital and access this care within River State? I mean, it's a River State government thing, right?
Absolutely.
So, unlike the private HMOs where some hospitals might not be having anything to do with them. So how does this work?
So how it works is for us to ensure quality and standards.
All right.
It's not every facility.
Yeah, definitely.
And we actually do work with public and private facilities.
Okay.
So you, for those of them that government is paying for through the Basic Healthcare Provision Fund, their entry point, most of them is through the public facilities. Okay. So it's government paying their people to ensure that their beneficiaries access care. But now for those that will pay any amount of money, for instance, you would want to question where you have your care. For you can choose to say, I want to access care in so and so a place, and you have that right. And you have a right to, after 6 months, to say, this place, I don't think I'm getting the right care that I need. I need to change my primary provider. And we can do that for you.
Okay.
So it's available to both private and public healthcare providers.
All right. Thank you very much, Dr. Vetty. Well, we'll have to go on a commercial break. When we come back, please keep those messages coming. We'll read them and we'll take your questions. Do stay tuned. .28 minutes gone past 2, and yes, we're still talking about the health insurance program, and of course Dr. Vetty Agala, who is the executive secretary of that particular program. She is here helping us understand what exactly that program is about and how people can be a part of it. All right, and so far she has said it's it's for the vulnerable. For now, the way they're handling it, it's something that they have decided to ensure that those who cannot necessarily afford to pay out of pocket can ensure that they can also get the health care that they need. All right, send them via WhatsApp to 0809 030 6416 0809 030 6416. You can also send an SMS to the same number. Okay, I will take it just for this particular program. So you can send me an SMS to the same number 0809 030 6416. Then you can also call in. The numbers to call are 0817 923 0002, 0817 923 0002, and 0817 923 0007. My name is Constance, and this is Mind, Body, and Soul on Nigeria Info. Okay, someone sent a message here, and the person says, "Good afternoon, madam. We have not come in contact with the scheme here in Ubimini. Ubimini is in Emoha local area, and so he says we need such insurance in our community." Ezekiel from Ubimini. And then some other person is asking, is it a monthly subscription? They want to understand how they can partake.
All right, so thank you, Eze from Ubimini. Right now in Emoha, we have a focal person for the River State Contributory Health Protection Program. If you go to the health facilities, you would see that there are already lives enrolled. Enrollment started in Emoha local government, I think in July, August. We have been enrolling lives. The reason we took a pause in September and now, of course, from this program, we'll go back to enrollment, is because we wanted to see the quality of care that our people are getting. It's not just about having the thousands and thousands of people, but we wanted to see this number of people that we have enrolled, 40,000 people. Are they getting the care that the governor has promised that they will get? Do they have the right quality? So, I mean, if we were to go all out every day to enroll, we would have our target. But it's not just about that target. It's about the quality of care that these people need to receive. Now, you talked about where people receive health care. First of all, before we started the scheme, we had to do assessment of the health facilities. It's not every health facility, whether government or private, that can provide the kind of care that we are promising. So that people are not paying doesn't mean that they should get just any kind of care. No, that's not what we want. So we're going from community to community, facility to facility, and we are encouraging people. Government is never able to do everything alone. No. So if you are in that community, we are looking at a target of 100,000 vulnerable people in River State. The max your community or your LGA may get may be about 6,000 or thereabouts.
Okay.
So what happens to the others? That's why we're calling on well-meaning people. So you can bring your people together and enroll them with the 15,000 naira plan, because that's the plan that government is paying for. And so you can get more people into the pool. And hey, it's not a monthly contribution. It's usually an annual contribution for those who are in the informal sector. For those informal sector, because they are working in a place where they are paid monthly and it is a certainty, those we can take monthly. Now, recently, in September, we started something. We started to assess the informal sector. A rapid assessment. What do they want? How do they want to pay? How much can they pay? All of those things. So we didn't just jump at it. We had to do certain things, do some actuarial analysis to say, okay, this is what an average number of people can try to afford. So it's not a monthly, but it's negotiable. All
right, we have someone on the line. Hello, good afternoon. What's your name?
Thank you very much. I'm Yadiebere Adil, calling from Abai in Aba.
Okay.
I have a sister, Amachi Nwamara Kalabo, who died about 2 months ago in Port Harcourt. She was taken to military hospital and they said that there wasn't any bed space. So they took her to a private hospital. There wasn't a doctor in that private hospital, but there was oxygen. Then they took her from that private hospital because there wasn't a doctor. They took her to Port Harcourt Teaching Hospital where there was doctor, but there wasn't oxygen. And my sister died. Let me tell you people in this context, what you people are doing is not good. You people, how much is oxygen? She is a well-trained teacher, a graduate, contributing immensely in her community where she's married, in Calabo community in Port Harcourt. Immensely, a very intelligent woman. And she died because of oxygen of how much?
Okay. I mean, I really can understand the passion, right? And how sad it is they had to go through all of that. Now, although he didn't, give any questions or ask any questions directly related to what we are discussing, but I'm going to bring out a question from what he's just shared with us, right? You said that you did just 40,000 plus in the first batch so that you could assess the quality of care that the people who are under the scheme are getting. Now, for someone who is under the scheme and would need something like an oxygen to ensure that this person survives, right? What are the measures that you have put in place to ensure that people in that kind of situation would not end up going through what this family had to go through? Go to the first hospital, there's no bed space. Go to the second hospital, there's no doctor. Go to the third hospital, there's bed space, there's doctor, no oxygen. I mean, having to run round in circles, and at the end of the day, this person dies.
I sincerely condole with him and family, and it's heart-wrenching, really. It is. And that's why earlier I had said it's not just about numbers. Every number is a human being, is an individual, is someone's sister, daughter, brother, something. Is someone's relative, and that makes it so important. So we're talking about 40,000 people, 40,000 families, and that's why we paused to say, okay, start assessing this care. What are the challenges? Because, like I said, from the get-go, we had done an assessment to say this facility has what it takes, at least to provide primary care and training to know when to refer, because there are different levels of care. I don't know where his sister was ab initio and how long it took them to make the decision to refer and what their referral mechanisms are. But for us at the River State Contributory Health Protection Program, we run a system where we just don't send you. You get a referral code, we talk to the facility you're going to, so they are expecting you. Okay? We get to know that they have what it takes, because from the referral and the conversation, we know what this person may likely need or what kind of specialty we'll be looking into. So we run that kind of system, and our governor has done well so far in the health sector to ensure that our facilities are also being upgraded, primary, secondary. Our tertiary hospital, I mean, is one of the best. If you go to the River State University Teaching Hospital, it is one of the best in this region of the world. And that's because there's commitment to ensure that things are put in place. There is human resource. So governor has just approved 1,000 health workers to be employed, and they're doing that. And very shortly, you would see that the people will start getting their appointment letters, from what I know. So it's not just about having a building that you have a facility. No, you need equipment, you need human resource, you need a lot. And those human resources need to be trained. And those are things that we've been doing, trying to train people, get them to understand what they need to do, know when to refer. Just recently, the Honorable Commissioner for Health had an engagement where TBAs, traditional birth attendants, were told what to do, how to send people for family plan, these things, because they are there and people are patronizing them.
Yeah, instead of shutting them down.
Absolutely. So the thing is, it's just like God gave us a choice. Everybody has a choice. And that's why I said if you're covered under the health insurance scheme, it would be unlikely for you to go to a place where you're not sure of. People go to those places for reasons of, okay, we don't have the money to pay. In that place, they probably don't take cash all the time. You can go with a bunch of plantain, those kinds of things. Or you don't have to pay at that point. Something. But more importantly is to say that in Rivers State, and I think that was in July or August, I'm not sure, we did a flag off and launched the oxygen plant. The governor himself launched that plant, and that plant has the capacity to feed the states in the south, to ensure that no child, no woman, nobody dies because they lack oxygen. So this is something I'm going to take back, because I don't know. I think it's in the University of Port Harcourt Teaching Hospital they were in, which is a federal facility. But even then, there is a logistic management team for the oxygen, and their numbers. I hope I can drop some here, and then we can let them know. Besides, the state emergency medical treatment and ambulance services or ambulance system is running. That was flagged off in the states. And the numbers are there, and people can call. And in those ambulances, there is oxygen. Okay. So it's all about people knowing. And I agree with you that awareness may be poor, and that's why we keep engaging. We don't stop. Carl called me today, and I said I was going to be here. We don't stop. We just keep, engaging, trying to tell people that these things are there. If a facility is there and you don't go for it, it's like a door is here, you open this door and there's food here. You stay out there and you starve. It's not because there is no food.
All right. We have another caller. Turn off your radio set, please. What's your name?
Hello, this is Chika. I'm calling from Port Harcourt.
All right, Chika, go on.
Oh, yeah. What the doctor is saying, health management is actually very, very key and is also very important. But when it's coming from government, I'm always skeptical about that. I have a sister who is under NHIS, but whenever she goes to hospital for diabetes and hypertension, they usually do not give her any drug. And most times the treatment she gets is that of, maybe they just look at how treatment. She can visit the hospital 3 or 4 times before she's able to see a doctor, just because she's under NHIS. So I just hope this one, they're rolling out in Rivers State, will not be like sometimes government things. Most times people really tend not to benefit from the program. And also, are the patients, are they going to tell them this is what we will do for you if you subscribe for this? Maybe surgery up to 500,000, we will cover it. This medication will cover it. This one will not cover it. Because I subscribed for my sister with one private health management organization, and they gave us this. And ever since then, she's been working with it and been working very fine. So I want to know, do they tell them what they stand to gain, what they can do for them, the limit?
All right. Thank you very much. Please go on.
Thank you so much. And what we're trying to do with the SIM administration is to build back confidence. To build the confidence of the people in the government, to build back their trust. I mean, we expect so much from government, right? And at the
same time, we don't expect so much from them, because there's, on one hand, people expect government to do a lot. On the other hand, like he said, people are also skeptical about anything that's coming from government. They are big.
So I'm here to say, give it a try. I mean, life is all about risk. Take the risk to trust the administration of Sir Siminalayi Fubara, because he's a man that is accountable. And so if you're working with him, you need to show accountability. This is someone that at the first year in office, he rendered accounts of what was spent, what he gave to which MDA and all of that. That's transparency. That's accountability. And so you can't work with him and not expect that he would hold you accountable. So we're saying that for now, we have tested the scheme. The scheme is in the hand of this administration. You can trust us to ensure that what we say you would get is what you will get. And yes, for those who are going to pay their 15,000 naira or whatever it is you're going to pay, as an enrollee, you have a right to have information. Information gives you your benefits and also your responsibility. Right. So you can't expect to have like everything treated because you paid 15,000. And sometimes we can be really, I don't know, it's like we are unrealistic. We are unrealistic.
It's government money, is our money.
But government has several priorities. Just the way health is looking for money, that's how education is. That's how the rural people are. Women, the agriculture, everywhere. And so you need to know that this administration has prioritized health. And that's why you can see all of these strides that are going on. Now, to answer him, yes, sometimes you will need to do what we call co-payments. And that's something you must do because the price of medications are very high.
All right.
So we have a 15% co-payment. So if your medications are 10,000, for instance, all you get to pay in that visit is 1,500 naira. And this is not for the vulnerable group. I'm talking about those that are paying. Okay. Vulnerable group, they don't get to pay anything. Okay. So your consultation, everything is free. Test, everything is free. But for medications, you get to pay a percentage. That just helps them to revolve that fund. And I think it's something understandable that anyone should be able to buy into.
All right, someone is asking, is the River State health insurance for only indigenes of River State? You're going to answer that again. And then he's also asking, are there any specific documents required from non-indigenes to benefit from this health insurance?
Absolutely none. What we require from enrollees is your basic biodata and your national identification number. Okay. So we need the NIN because we need to really identify you. It's a unique identifier. We've had people go to hospital with someone else's card and, that kind of thing. So you need the NIN to be able to say this is Mr. Paul Jack or something.
Yeah, it's a no-brainer. It's a normal thing,
so
right?
Those are just usual things. Now, what makes our scheme kind of different and a social scheme is because we are not exactly for profit. Plus, we don't say, oh, you have a high risk. This man, you drink, you smoke, you're likely to, have a heart problem. Do you understand? Because that's what HMOs would do. They will actually look at your risk profile. And so the package they give to you, you pay more if you have more risk. You pay more if you're older and more likely to, have certain kinds of illnesses. That's how it works in that space. But for us, because it's a subsidized thing, because it's a social health insurance, because we want to carry those who cannot, because those are the people that are not insured. Those who can are already in their private insurance. I hope you know. A lot of people are covered. So the people, when you hear that our maternal mortality is high, is because of those people, poor people, who instead of going to antenatal, they stay at home, they do massage, they do all sorts, because they believe that you can actually deliver with or without that. All and right. Then what happens.
Okay, someone says, I want to ask, are there infirmities that are not captured in this venture? Finally, this campaign will experience lots of trust issues in my community. Ubi mini. Because the healthcare center there is only operating on paper. What's the confidence this time that we will begin to see the least paracetamol and syringes this time to evaluate these health challenges, and not just the usual empty non-functional buildings with workforce whose aim mostly is to come and answer present for their alawi to keep entering? And then another person is asking if the it says do you not know that there are people who cannot afford whatever medical expenses, even to pay as common as malaria test? If the government in Nigeria, both states and federal, can't provide the basic medical care to the citizens, they should go away. And then this person says, Dr. Agala, how did this insurance scheme in past I'm free 60 years and children 60, 80 or pay for this scheme yearly?
So if you're 60 years and above, you qualify for an arthritis. We look at common diseases, things are common, and pull them together and say, okay, so if these people are going to be ill, these are the likely things, for most of the time. And those are usually able to be covered by what we already pay to our providers. Now, speaking of Ubimini, as I leave here, I'm going to make a call. And tomorrow, at the earliest or latest, let's say, you would have feedback on Ubimini and what is happening in their facility. But recall that I said it's not even every public facility that is on our scheme, because we needed to see that there is a facility, that there are human resource, and that there are equipment that are going to be able to tend or attend to our clients. So how do you enroll? If you are in the community and under the Basic Healthcare Provision Fund, you can be enrolled through the facility. We have people around the community. You can be enrolled, and it's actually a digital thing. So our people are there to do that.
Is there an app yet?
Yes, there is. There is not an app yet on our website, but there will soon be one. Before this month ends, you will have that app on, because we're working on it, and we realize that there are so many people who may not need to come to us.
Exactly.
They just need to self-enroll and then pay. So for those who would do self-enrollment, they have to be those who can pay.
Okay.
Not the ones that we are, because for us to decide who is vulnerable, we are triangulating. So we have the social register, and then we have community people alluding to the fact that these people are actually unable to afford this, because we don't want those who can afford to get the services of those who cannot afford. So there's a lot of work to do at the back end to ensure that these things are working. But I'll share with us our website, our numbers. Okay, so our website is www.rivchpp, which is rivchip.rv.gov.ng. Okay. I'll take it again, www.rivchpp.rv.gov.ng. So Riverment Nigeria. So just you have 18691469169. RVCHP. On ID we are at RIVCHPP. So ID is RIVCHPP. Twitter, it is RVCHPP, and then on Facebook, it is the full name, Rivers State Contributory Health Protection Program. You can put Rivers State Contributory Health Protection Program on Google and find us at the Waterlight House on Aba Road.
All right, thank you very much, Dr. Vetty Agala. I'm seeing many more messages, but apologies, people. We can't take any more. We have to go now. Of course, Dr. Vetty has given us an overview of what the River State Contributory Health Insurance Program is about. All right. So thank you so much for coming on the show today.
Thank you, Constance.
All right. And that's where we draw the curtain on the conversation and, of course, on the show. The sunny side. I'll see you tomorrow. Tomorrow is Friday. All right. We have the news, but before the news, there's a recorded program for like 5 minutes. I'm seeing the Diamond Project. So that's going to come up. And after that, the news, Rivers Today. And after that, we're going to have Kalada in the studio to take you on hard facts. Don't forget, follow us on social media, Nigeria Info 92.3 PH for Facebook, Nigeria Info FM _PH for Instagram, and Nigeria Info PH for X. You can also find me, Constance-Mega on X, and Constance Iroele on Facebook, and Constance-Mega elsewhere. God bless you.